Does neurology recommend imaging for all headache patients? Have you ever wondered if everyone with headaches needs to get an imaging test? This is a common question, especially for those who experience frequent headaches or migraines. Let's break it down. Neurology does not recommend neuroimaging, like magnetic resonance imaging or computed tomography scans, for all headache patients. Imaging is generally reserved for specific situations. This means that most people with headaches do not need these tests unless there are signs that something more serious might be happening. For example, if you have headaches that fit the typical patterns of migraines or tension-type headaches, and your neurological examination is normal, imaging is usually not necessary. In these cases, the chances of finding anything significant on the imaging are very low. Plus, getting an image often does not change how a doctor would treat the headache. So, when is imaging considered appropriate? If a patient shows abnormal neurological findings during an examination, or if the characteristics of the headache suggest a secondary cause, imaging may be needed. Some signs that might prompt a doctor to recommend imaging include new or unexplained neurological symptoms, sudden severe headaches, or changes in headache patterns. Other concerning signs include headaches accompanied by confusion, weakness, or if they occur later in life. If someone has had a head injury or if there are concerns about vascular issues, imaging may also be indicated. A thorough clinical assessment is key. Doctors will look at the patient's history, headache patterns, and any associated symptoms to identify any red flags that would warrant imaging. When imaging is necessary, magnetic resonance imaging is often the preferred method due to its detailed images of soft tissues and the absence of radiation. Computed tomography scans may be used in emergency situations, like suspected bleeding or trauma. It is important to note that unnecessary imaging can lead to incidental findings. These are often benign issues that can cause anxiety and lead to more tests without providing any real benefit. Leading neurology organizations recommend against routine imaging for primary headaches unless there are abnormal findings or significant concerns. This approach helps doctors identify serious conditions while avoiding unnecessary tests for typical headaches like migraines and tension-type headaches. In summary, not everyone with headaches needs imaging. It is reserved for those with abnormal neurological exams or concerning headache features. This helps ensure that patients receive the right care without unnecessary procedures.